Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hello viewers, this is Dr. Sam signing in today's Doctor's Voice. Viewers, today we'll get to know about cancer. That must be a horrifying thing for us, and we will try to get the latest answers for cancer, for which we have got Dr. Wong Chiang Ying, Senior Consultant Medical Oncology, Parkway Cancer Center, Mount Elizabeth Hospital, Singapore, with us. Dr. Ong received her bachelor from University of Manchester, UK, and later she obtained MRCP UK. Then she joined National University Hospital, Singapore as Consultant Medical Oncologist, and now she is serving as Senior Consultant Medical Oncology at Parkway Cancer Center, Mount Elizabeth Hospital, Singapore. Dr. Ong specializes in the diagnosis and treatment of adult cancer with a special interest in breast and gynecological cancers. Viewers, let's begin the discussion. Hello, Dr. Ong. Welcome to SATV. Welcome to Dhaka.
Thank you very much. It's great to be in this beautiful city.
It's our pleasure to have you in our today's shows. So as our today's topic is cancer, firstly, I would like to know what are the common cancer you deal with?
I deal with all sorts of cancer, but I have a special interest, especially as a woman, in breast and gynecological cancers, because I tend to identify a little bit more with them.
Okay. So I would like to begin with breast cancer, which is now pretty much common in our country.
Yes.
And firstly, I would like to know what are the common presentation, and before that, do you think the incidence of breast cancer is increasing day by day?
Yes, I think so. Breast cancer actually, accounts for about 30% of women's cancer around the world. So it's actually pretty common, and it's pretty standard. The statistics, across the continents. And yes, it is the commonest cancer for women in both developed and non-developed countries.
Okay. And I would like to know who are the person are more likely to get breast cancer. Is there any particular risk factor for that?
Yeah, so there are a number of risk factors, for developing breast cancer. So some of the risk factors are actually not modifiable. We can't change it. For example, breast cancer increases with age. So as we grow older, unfortunately, the risk of developing breast cancer becomes higher. For example, if you are in your 40s, 30s or 40s, the rate of cancer is about maybe 1 in 70. But as you grow up to maybe about 60 or 70, the risk is about 1 in 30 women, so it's more common. So some other risk factors which are not modifiable are like if you have an inherited condition, so if you have a strong family history of cancer, especially if you have a mutation. We have this mutation called the BRCA mutation, BRCA mutation, which can be inherited. That predisposes a lady to get breast cancer. Not only breast cancer, but other cancers like ovarian cancer as well. So these are the things that we cannot modify. Breast cancer is actually a disease which is stimulated by female hormones. So there are certain other risk factors which increases the hormone levels in the body, and this sometimes can be modifiable. For example, obesity. So if a lady has got a lot of fats, they have got more hormones, therefore increasing their risk, and lack of exercise, a sedentary lifestyle,
which is pretty much common nowadays.
Yes, correct. And then when patients have their first child quite late, or never had any childbirth, okay, or very early age of menstruations, early onset of menstruation, or late menopause, meaning that the duration of hormones in the bodies are longer. And there are certain diets, for example, red meat and alcohol has also been shown to maybe increase slightly the risk of cancer. Yeah.
So apart from those non-modifiable factors, there are some particular modifiable factors where the general population can put some focus to get rid of breast cancer. Well, about the common presentation, I would like to know.
Yes.
In case of breast cancer.
So the commonest presentation is a breast lump. Yeah. So and any abnormal breast lumps always needs to be investigated. So we always have to emphasize the importance of self breast examination. Usually done every month, about 1 week after the menstruation starts, because that's where the breast tissue is the least dense. Okay. So usually we advise patients or ladies to actually examine their breasts regularly every month. And the other kind of presentation that can happen, because when you look at yourself in the mirror while you examine your breast, you have to look for changes in the skin, all right? It may become very hard, very red, and sometimes the nipple may have some discharge, or the nipple get inverted, meaning it goes inside, okay? A lot of the breasts actually do not present with pain. So even though it's not painful, doesn't mean that it's not serious. So as long as there is something abnormal, we should get it examined. And not only the breast, we also have to examine our armpits under the, the lymph node, for any lumps under the armpits, because that's where the lymph nodes are, and we have to make sure that there's no lumps there as well.
Right.
Yeah.
So these are the common presentation, and mainly a breast lump.
Yes.
That is a cornerstone of the presentation. Now I'd like to know, how do you approach when you are suspecting that this gentle lady might be having breast cancer, and then how do you approach for treatment and investigation?
Okay. So usually the first step is to go, we examine it as doctors, we examine, and then we see any suspicious lumps needs to be evaluated further. We start off usually with a mammogram, okay, and then and mammogram is essentially an X-ray of the breast, okay. So they compress the breast and they take a picture, almost like a chest X-ray, but just X-ray of the breast. On top of that, we will sometimes do an ultrasound of the breast as well to see again the features of the lumps. Sometimes when the lumps are, a little bit inconclusive, or we suspect that there's a very strong family history with BRCA mutation, we may even do another more detailed scan called the MRI of the breast as well. Okay, but that's not
always
routine.
necessary.
Okay, yeah. So again, we have to see the need for it. Then the next step is to get tissue biopsy, okay, a tissue specimen of the lump, which is very important, and because that not only helps us to confirm the diagnosis, but also we can send it for, tests to see, what kind of, cancer it is. So that, and then we have to evaluate whether or not the disease is localized, is it resectable, and then we'll discuss the next step with the patient.
Okay. So what I got from your saying that to diagnose a cancer, the imaging in terms of X-ray and ultrasonogram might not be the definitive, might not give the definitive answer.
Yes.
For that purpose, you must need to get a tissue from the particular area.
Yeah.
And after that, when you diagnose it is a cancer, after that you go for to define the extent of the disease.
Correct.
Okay.
Yeah.
So now I would like to know about the treatment options.
All right. So, breast cancer is usually divided into 4 stages. All right. At stage 1 and 2, they are usually localized in the breast. Okay. At stage 3, it would have spread to the lymph nodes. In the armpits, the axillary lymph nodes. At stage 4, it would have spread to the rest of the body. For example, the liver, lung, or bones. These are the main sites of metastases. We call it, when it has spread, metastases to these areas. So if it is all still localized, usually, and we usually have to. We usually do what we call a PET scan, which is a more detailed scan of the body to look at to see whether or not the disease has spread to other parts of the body. Okay. So if it is localized, meaning that it's all just here, as established by all our investigations, we would usually opt for surgery first to remove the tumor, and then we will sample the lymph nodes in the armpits, again to determine the extent of the disease. Sometimes, when if the tumor is too big, it's difficult to resect, we may give some treatment before the surgery to shrink the tumor, so that it gives it makes the surgery a little bit more complete and more easier to us to resect. Yeah. So that is surgery, okay. But in metastatic disease, usually the treatment options are more chemotherapy based. Before we go to metastatic disease, after surgery, usually again depending on the extent of the disease, we usually offer some chemotherapy, again because we want to eliminate any microscopic disease that we cannot see. Because what we can see, we remove by surgery, but we are worried that there are some cells that may have escaped already. So we use chemotherapy again to eliminate those that we cannot see. So that is what we usually do after surgery, and again depending of the extent of the involvement, we also may have to give radiotherapy. To achieve some local control. All right, and then with the cells that we take out, we examine to see whether or not how stimulated it is by the hormones. how stimulated this cancer is to hormones, and whether or not it is sensitive to another receptor called HER2. All right. Again, these are the three things that we usually look at. And if they are all sensitive to this, we give hormonal treatment, and we give this HER2 targeted therapy to prevent the growth of the cancer cells.
So we will get to know more about this targeted therapy. That must be a new concept, and we'll get to know more about these things just after a short break.
Yeah, thank you.
Thank you. Viewers, today we are talking about cancer, and we'll get to know more about these things just after a short break. Viewers, welcome back to Doctor's Voice. Today we are talking about cancer, especially breast cancer and gynecological cancers, with Dr. Wong Ching Ing, Senior Consultant, Medical Oncology, Parkway Cancer Center, Mount Elizabeth Hospital, Singapore. Let's get back to the discussion. So before the break, we were listening from you that how do you proceed for breast cancer, and you were saying that if the tissue of the diseased person is positive for some markers, like you were saying HER2 and ERPR, in these cases you go for targeted therapy.
Yes.
Can you please shed some light on what it is, targeted therapy?
So targeted therapy is a very new concept, well, not actually very new, but it's been around for some time.
Right.
So hormonal therapy was probably the first targeted treatment. So essentially, in the normal cells, there is actually well, in all cells, there's actually what we call a growth switch. All right. So this switch actually tells the cells inside to divide, to die, controls what happens in the cell. But in cancer cells, okay, this growth switch is actually turned on. Okay. And there's a lot of growth switch expressed on the cancer cell surface. So when you have a lot of this growth switch, which means that's positive, it means that it's positive, it actually switch it on, you see, and therefore causing the cells to grow in very rapid and aggressive fashion. Okay. So the targeted therapy is to examine whether or not this cells has got this growth switch, how much of it has got, and attempt to switch off the growth switch. So it's like a light bulb, lights like that, you turn it off, and hopefully that will prevent the growth of the cancer cells. So estrogen and progesterone receptor, which are the hormone switch. HER2 is another switch present on about 25% of breast cancer cells. So if we have a therapy to switch it off, then we hope that it will prevent the growth and kill off all the cancer cells. So the hormonal therapy targets the hormone switch, then a drug called Herceptin, and another drug, a new drug now called pertuzumab, will switch off the HER2 switch. So that in combination with chemotherapy will give a better response and prevent the recurrence of the breast cancer.
Thank you for explaining it in such a palatable way.
Yeah.
Now I would like to know some words about gynecological cancers. What are the common cancer you encounter, especially from the patients of this part of the world?
Yeah. So the gynecological part, ovarian cancer still accounts for maybe about 20% of the women's cancer, and in this part of the world, I think cervical cancer is also very prevalent, maybe about 10%. Okay, so these are the two main gynecological cancers. There are also others like uterine cancer, fallopian tube cancer, but those are less common. So the common presentation of gynecological cancer is usually abnormal bleeding. All right, so this is abnormal bleeding between, say, if you have abnormal bleed between menstruation, you have post-menopausal bleed, meaning after your menopause, then you bleed. You have bleeding after sexual intercourse, okay, or you have some abnormal vaginal discharge. So these are all abnormal bleeding, so that has got to be evaluated. Now, for ovarian cancer especially, usually the early ovarian cancers unfortunately don't have much symptoms, but as they grow bigger, you can imagine that there's a big mass in your abdomen. They actually will present with abdominal distension, abdominal bloatedness, and you feel full very easily because it's pressing onto your intestine. And sometimes when it presses onto your bladder or your intestine, you may have some difficulty passing urine or passing motion. So these are the things that we need to be aware of.
Need to be addressed. Well, about you said about the common presentations of gynecological cancers. How do you approach in terms of investigation?
Yeah, so if you have such symptoms, usually for cervical cancer or any abnormal bleeding, we should see a gynecologist, as soon as possible, because they have got an equipment to actually do what we call a pap smear, all right, to see and essentially just opening up the the vagina area, and then they put a swab in to take some tissues from the cervix for examination. On top of that, they can usually do an ultrasound as well of the abdomen and pelvis to see whether there's any abnormal masses. So if something like this is suspected, we will have to proceed to a CT scan or a PET scan as well, okay, to see whether or not there's spread of disease elsewhere.
Okay, so this is how you go for to establish the disease and to look for the extent of the disease. And about the treatment options, what are the options you can offer to the patient?
Yeah. So gynecological cancers, for ovarian cancer, the mainstay of treatment is still surgery. Okay, so if it is resectable, we should take it out because that's their only chance of cure. All right. So after again surgery, we will also consider giving chemotherapy again to eliminate some microscopic disease. Okay, and but for cervical cancer, it's a little bit more. The treatment options are a little bit different. Early stages, like very early stages of cervical cancer, usually is also surgery. But however, because when cervical cancer becomes more advanced, it gets stuck to the wall of the pelvis. So surgery usually is not the treatment option for this, and we usually recommend for chemotherapy and radiotherapy. We talked about radiotherapy, which is like a X-ray treatment to the the radiation treatment to the tumor, and we combine it with chemotherapy so that it will give a better response, and that's how we treat usually cervical cancer.
And we'll get to know more about these things just after a short break.
Yeah, thank you.
Thank you. Viewers, today we are talking about cancer, and we'll get to know more about these things just after a short break. Viewers, welcome back to Doctor's Voice. Today we are talking about cancer, especially breast cancer and gynecological cancers with Dr. Wong Ching Ing, Senior Consultant, Medical Oncology, Parkway Cancer Center, Mount Elizabeth Hospital, Singapore. Let's get back to the discussion. About the chemotherapy, this name can make anybody mad.
Yes.
The chemotherapy,
Yes.
lots of side effects. So how do you manage these side effects, and how the patients are coping with this chemotherapy?
Yeah. So chemotherapy is actually the first. Well, not first. This is one of the mainstay, and still remains to be the mainstay of treatment for cancer. And however, chemotherapy works by killing off rapidly dividing cells. So they cannot differentiate between normal and cancer cells. So while you try to kill off the cancer cells which are rapidly replicating, you also kill off the normal cells which are rapidly replicating, and that includes our hair, our intestinal tissue, that's why, and all the gastric tissue. That's why people lose their hair, they start to vomit, they have diarrhea, and they also kill off the red cells, white cells, and the platelets of our body, making us more susceptible to infection. But in recent years, there have been a lot of drugs that have been developed to combat all these side effects. And nowadays, actually, chemotherapy is quite well tolerated. And we have got injections to help to boost up the white cell. Therefore, the risk of infection becomes less. And we are hoping to move towards more this targeted therapy. But unfortunately, we are not quite there completely yet. We cannot replace targeted therapy with no chemotherapy at all. We still need to combine them together so that we can get a better response.
Outcome in terms with minimum complications and suffering.
Yes.
So about the radiotherapy, is there any recent advancement in case of radiotherapy, especially when you offer this to cervical cancer?
So in the past, the radiotherapy is not so the machine, cannot target the tumor
Not
more.
so focused.
Not so focused, yeah. But in recent years, they have improved on their technology. They have got what we call IMRT as well, and it's actually more targeted at the lesion with less, side effects to the surrounding tissue. So, for example, like cervix, we try to avoid the bladder, we try to avoid the intestine. There are some advancements, so now the treatment for cancer is actually, well, I wouldn't say it's completely no side effects, but I think the side effects are much, much less.
Much less, and it can be manageable.
Correct.
Well, going back to breast cancer, I would like to one question that can it happen to male persons, men?
Right. The answer is yes, especially if you have the BRCA mutation. Actually, the risk of breast cancer in men is probably less than 1%, in their lifetime. But if you do have a BRCA mutation, unfortunately, the risk increases to higher, and therefore you still need to be vigilant. In terms, and how do you be vigilant? Meaning you actually look at your family history, So if there's a lot of family members who has got breast or ovarian or endometrial or pancreas cancer, these are the or prostate cancer. So these are the group of patients and family that needs to be a little bit more vigilant about this mutation.
Particular mutation. Well, when somebody, for like a young lady who tested positive for BRCA mutation, and there's a family history that her mother was positive, ultimately succumbed to cancer breast. In that case, is there any particular prophylactic measure you can offer to those that particular lady?
So for this group of patients, this lady, so this patient also needs to be tested, for the BRCA mutation.
If it is positive.
Yeah. So if it is positive, actually you have to start screening them at about 25 years old, all right, because the risk of breast cancer is much more increased, probably about 60 to 70%, all right. We will also discuss the role of prophylactic mastectomy, for this group of patients, and after they have completed their child. They have finished completing their family. We also have to talk about prophylactic oophorectomy, meaning taking out their ovaries.
Ovary out as well. There was a famous celebrity who was BRCA positive, and ultimately she underwent mastectomy, if I am not wrong.
And also the oophorectomy, Angelina Jolie. We call it the Angelina Jolie effect. Actually, thanks to her, it's easy for us to explain this to our patients. Yeah.
Right. Well, we are at the end of our show. Leslie, do you have any message for our viewers to throw?
Yeah, I think to me, cancer is actually not a death sentence. I feel that a lot of people think that, when I diagnosed with breast or whatever cancer, that is the end of our lives. But it's actually not true in this day and age, especially when the diagnostic, the treatment options are so wide, and so readily available and it's so effective. So I think, it's important to actually go for screening. That's another thing that I cannot emphasize enough. When you are 40 years old, you should go for yearly mammograms, And if you've ever had any sexual intercourse, you should start going for pap smears at age 25, So with early detection, you can detect the cancer early, you can treat it early, and you can actually cure it, and the chance of cure is very, very high, and the prognosis is really, really very favorable. So it's definitely not a death sentence, so don't be scared. Yeah.
Thank you. That's very positive. Thank you, Dr. Hong, for being at my show.
Yeah. Thank you very much for having me.
I wish you have a safe journey back to your home.
Thank you. Thank you.
Viewers, that's all for today. Hope to see you on next episode. Till then, stay fine, stay tuned.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. You have the best of the best working in this hospital.
The clinic's actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with
There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many
that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch is possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.